Hello, my name is Samantha Wink, and I will be discussing cardiomyopathy. What cardiomyopathy is, a prescription test for that, how it's diagnosed, and the treatment plans that follow. So, what is cardiomyopathy? Cardiomyopathy is disease of the heart muscles that makes it harder for the heart to pump blood to the rest of the body. This in turn can lead to heart failure. Around 7 out of every 100,000 people are diagnosed per year with cardiomyopathy. There are 3 main types of cardiomyopathy, including dilated, hypertrophic, and restrictive cardiomyopathy. Now, dilated cardiomyopathy is where the heart's left ventricle becomes dilated and can't pump blood out of the heart anymore. Hypertrophic cardiomyopathy is the abnormal thickening of the heart muscle, which makes it harder for the heart to work. It mostly affects the muscle of the left ventricle. Restrictive cardiomyopathy is where the heart muscle becomes stiff and less flexible, so it can't expand and fill with blood between heartbeats. This is the least common type of cardiomyopathy, but it can occur at any age, but it mostly affects older people. There are 2 other types of cardiomyopathy that I do have listed. The first one is arrhythmogenic right ventricular dysplasia, which is a rare form of cardiomyopathy. This is where the muscle in the lower right ventricle is replaced by scar tissue, which can lead to heart rhythm problems. It is often caused by genetic changes. And then there is a subsection of unclassified cardiomyopathy, which contains all other forms of cardiomyopathy. So how is it diagnosed? So the diagnosis of cardiomyopathy can be concluded from a number of different tests. The first one is a chest X-ray, which will show an enlarged heart. The second test is an echocardiogram, which uses sound waves to create images of the heart, show size and motions as it beats. This test checks heart valves and helps determine the cause of symptoms. An ECG is used to show disturbances in the electrical activity of the heart. A treadmill stress test is to evaluate symptoms and determine exercise capacity and whether or not exercise can trigger irregular rhythm. Cardiac catheterization is used to reveal blockages in the blood vessels. And then they also do occasionally use cardiac MRI, which is only used if the images from the echocardiogram aren't helpful in making a diagnosis. As for the risk factors of cardiomyopathy, this would include a family history of cardiomyopathy, heart failure and sudden cardiac arrest, long-term high blood pressure, conditions that do affect the heart, obesity, long-term alcohol misuse, illicit drug use, and then treatment with certain chemotherapy drugs and radiation for cancer. Okay, now as for the treatment for cardiomyopathy, follows treatment plans similar to individuals who do have heart failure. Studies show that lower exercise intensity has been preferred for several reasons, but I'm only going to mention the main 3. The first reason is low to moderate intensity exercise carry a relatively low risk for cardiac complications and musculoskeletal injuries. The second reason is patients are more likely to participate and sustain lower intensity exercise. And lastly, physicians are more comfortable with advising low intensity exercise. This data can all be found in an article called Chronic Heart Failure and Exercise, which I will have linked at the end of my PowerPoint. Pharmaceutical therapy is also used in treating cardiomyopathy the same way it is for heart failure. There are a multitude of drugs used, but I'm only going to mention the most prescribed drugs that have indicated the most benefits in patients who do have cardiomyopathy. So those are some of the drugs we actually have already talked about. The first one is beta blockers, which are considered a major advance in the therapy of heart failure. Beta blockers showed a 34% relative reduction in all-cause mortality using bisoprolol and metoprolol supination. ACE inhibitors reduce mortality, hospitalization, and progression of heart failure, as noted in several trials. There was a new drug that I did see being prescribed. It is called an ARB, which stands for angiotensin receptor blockers, and this provides a reasonable alternative to ACE inhibitors for patients who are intolerant to those antigens. As for the effects of exercise with cardiomyopathy, research shows that exercise can improve the symptoms of cardiomyopathy. Not only physiological, but psychological benefits can be brought on by constant exercise. Exercising with cardiomyopathy has been shown to increase VO2 max, reduce left ventricle wall thickening, improve diastolic function, and improve overall blood pressure. As for the psychological benefits, exercise can lead to an improved metabolism, help maintain weight, and improve overall confidence. Alright, then as for my case study. For my case study, the patient is a 57-year-old man who has a history of cardiomyopathy. Mr. T just underwent cardiac rehabilitation because he had a heart attack 3 months ago. Mr. T has been prescribed beta blockers by his physician and is responding well. Mr. T had to perform a treadmill stress test, specifically the Bruce protocol test, to be cleared for cardiac rehab. The patient's resting heart rate is 76 beats per minute and has an elevated blood pressure of 130/82. The patient has no history of smoking and has cut out all salt and alcohol. Mr. T enjoys taking his dog for walks and going to the dog park. He also enjoys using the pool at his gym. His physician has cleared him to start an exercise program in order to manage his symptoms, help reduce his blood pressure, and help benefit him mentally. As for his exercise prescription, for his program, I want Mr. T exercising for a minimum of 150 minutes a week, roughly 30 minutes a day, but he can break this up and do 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes at night, if that fits his schedule better. Mr. T has a heart rate reserve of 87 beats per minute, and since he is only performing at 50% capacity, I do not want his heart rate exceeding 120 beats per minute while he is performing any exercise or physical activity. Since Mr. T enjoys taking his dog for walks, on weather permitting days, I want him walking for 30 to 60 minutes as tolerated and monitoring his blood pressure and heart rate. I extended this to be a maximum of 60 minutes since Mr. T is used to walking his dog, and because we are trying to progress his aerobic endurance, I do want to see if he can extend that for more than 30 minutes. Since Mr. T also enjoys the pool, I would recommend swimming laps around 2 times a week, and only for a total of 30 minutes per day. I left this at 30 minutes per day because swimming takes more out on the body and you are using more muscles. I want to limit that to 30 minutes. I also would want him to have someone accompany him while he swims to monitor his symptoms and be there in case anything happens. I would also recommend that he signs up for water Pilates at his local gym. This would benefit him not only from the social aspect, from meeting new people, but also from having others around to be able to watch him in case of an emergency. I also want Mr. T to perform yoga for at least 10 minutes a day. He could also sign up for a yoga class at his gym, which could last longer, and that is perfectly fine as well. I recommend yoga to improve his musculoskeletal function and to work on his breathing, since we do want to make sure he can control his breathing and in case anything goes wrong, to be able to have breathing exercise to work on in case he has anxiety. I do want him to know how to utilize that. Yoga would also benefit him mentally from helping reduce stress and calming him. I do not have strength training listed yet in his exercise program, and that is for a reason. As we progress further into his program, I will start to introduce body weight strength training. I did not want to include this in his plan yet, since he had a heart attack only 3 months ago and was recently cleared from cardiac rehab. I felt it was too soon to introduce strength training. I also want to monitor him closely and see how he progresses with the current program. As I learn what he can tolerate, I will start to introduce strength training and increase his aerobic intensity. I wanted to keep it minimum for now because of his recent heart attack. I did not want to overwhelm him to begin with. As for our conclusions with today's presentation, cardiomyopathy can be managed and treated similarly to those with heart failure. Cardiomyopathy symptoms are improved with exercise, and there are numerous studies and research done to indicate this. Most exercise prescriptions for cardiomyopathy is recommended at a light intensity, meaning like 50% of their VO2 max. This is because most exercise cases or exercise prescriptions for those with cardiomyopathy are for those with hypertrophic cardiomyopathy, so their heart is restricted, making it harder to pump blood to the rest of the body. That is all I have today. I hope you were able to learn something. I hope you got the take-home message that cardiomyopathy can be managed and is manageable with exercise. Thank you.